Let me, yeah. So let me stop sharing the screen and let Miss Sampada Patole, she's the manager of the Restorative and Regenerative department, start the webinar. Sampada, if you would like to share the first screen.
Good evening to everyone here. So I am Sampada. It is my honor to introduce our distinguished speaker for today, that is Dr. Paresh Doshi. Dr. Doshi is a director of Restorative and Regenerative Medicine as well as a director of Neurosurgery and Functional Neurosurgical Program at Jaslok Hospital, Mumbai. He holds several prestigious positions globally. Currently, he is the secretary of the World Society for Serotactic and Functional Neurosurgery and the past president of the Indian Society for Serotactic and Functional Neurosurgery. He also serves on the boards of the International Neuromodulation Society and the Asian Australian Society for Serotactic and Functional Neurosurgery. He is also part of the International Task Force for the Psychiatric Disorders. With over 60 scientific publications and more than 550 invited lectures worldwide, Dr. Doshi has made remarkable contributions to the advancement of neurosurgery. He is also the proud recipient of the PhD from Rajasthan University and the numerous awards in the field of the medicine and neurosciences. We are truly privileged to have him with us today. Please join me in the welcoming Dr. Paresh Doshi.
Thank you, Sampada. Okay, if we can stop sharing and I will share my screen. Okay. Before I move on, Karina and the team, if you can try to check if people are facing difficulty, then we should have another link or a shortcut which we can immediately share with them so that you can message them or WhatsApp them immediately to join.
Yes, sir.
Okay, thank you. So now we move on and good evening and welcome to all the guests and attendees of the webinar. Uh, this is something very interesting topic and which is very common, which I will show you in the next few slides. And it is like affecting all of us in a day-to-day life. And what is that? And that is we are going to talk about today migraine, which is one of the most common headaches and memory impairment, which unfortunately is becoming part and parcel of our daily life. So what is mild cognitive impairment? So let us understand the definition. Mild cognitive impairment is a condition characterized by cognitive. Cognition is memory. Cognition mana memory that is greater than expected for patient's age. Because we all know that as we age, our brain cells die and the memory starts declining. So we know that our grandparents are having some forgetfulness and we take it in our stride. But what if it happens to a 40-year-old person? What if it happens to a 25-year-old person? What if it happens to a 55-year-old person? When it is considered abnormal, when it is considered normal, when it is considered part of aging, and that is what is important for us to understand. And if we understand, then we can preempt it. If we preempt it, we can prevent or actually slow down the progress. So mild cognitive impairment is some memory dysfunction which actually does not affect our quality of life or daily activities. So we are able to circumvent, as I will show you in the next few slides. Let me show some figures to you. Recently in 2024, the week published that about 3.5 crore Indian might be suffering from mild cognitive impairment. Another study showed that the prevalence of mild cognitive impairment can range up to 20%, which is a huge amount. And though if we think that it doesn't affect young patients, we are mistaken, the most productive age group, that is 40 to 60, it's the most productive age group. A study from Pune showed that around 30% of the people can have memory deficits. Now that is shocking because if that is the case, then we require to understand that, we require to take care of it, we require to see what we can do to prevent it. So let me break down the type of cognitive impairment or memory impairment. And what is that? One is amnestic, which we all understand, forgetfulness. मैं दवाई लेना भूल गया, मैं किसी को पैसा दिया था, मैं भूल गया कि whether I gave money to the sabji wala or not. I forget the words. I'm talking, sorry, I didn't remember that. We forget names very commonly. ओ हैड मेट दैट पर्सन, याद नहीं आ रहा है, एक मिनट, अरे क्या था नाम उसका? अभी some people have this naturally, some people have developed it after a little time, means as they age, and then if that is a new symptom, then it has to be considered or looked into. However, these are not only the type of memory impairment. Memory can be impaired in many other ways. Amnestic, मैंने जैसे बताया, भूल जाना, forgetfulness. नॉन एमनेस्टिक, जहां पे भूलना नहीं है लेकिन डिफरेंट पार्ट ऑफ मेमोरी एरिया ऑफ द ब्रेन इज अफेक्टेड. एमनेस्टिक मल्टीपल डोमेन, भूलने का लेकिन मल्टीपल एरियाज ऑफ द ब्रेन इफेक्टेड. एंड नॉन एमनेस्टिक, non forgetfulness but multiple areas affected. So let me show you what are this meaning. So complex attention, अगर आपका attention कम हो जाता है, complex attention, and where do you find this? That person is easily distracted. बात करते हैं तो एक बात में से दूसरी बात में चला जाता है. Continuity of the talk doesn't occur. He takes longer time than normal to come back to the continuity of talk. मेंटल कैलकुलेशन बोला तो पहले जो इजीली कर सकता था वो अभी कैलकुलेशन नहीं कर सकता है. दैट इज कॉम्प्लेक्स अटेंशन. एग्जीक्यूटिव फंक्शनिंग, आज के जमाने में सब लोग मल्टीटास्किंग करते हैं. पीपल डू मल्टीपल जॉब्स एट वन टाइम. मैं मोबाइल पे भी करता हूँ, म्यूजिक भी सुनता हूँ, और किसी के सामने साथ देख के बात भी करता हूँ. सो 3-4 टास्क आई एम यूज टू डूइंग इट, एंड द यंगर जनरेशन इज मोर एप्ट टू डूइंग इट देन द एल्डरली पीपल, बट दैट स्टार्ट्स गेटिंग अफेक्टेड. मिसप्लेसिंग थिंग्स, मैंने चाबी कहाँ रखी थी, अरे सुबह में तो मैंने इधर रखी थी, मिलती क्यों नहीं है? सो दिस आर द थिंग्स दैट इज लर्निंग एंड मेमोरी. लैंग्वेज, आई टोल्ड यू फ्यू मिनट्स बैक, वर्ड फाइंडिंग डिफिकल्टी, वो भी एक प्रकार का मेमोरी है. ब्रेन के अंदर अपने नाम, नेम्स, नंबर्स, एवरीथिंग इज स्टोर्ड. दैट गेट्स शेकन अप, ऐसा दिमाग हिला के बाहर आता है when we have to talk or remember it, and when we want to recollect it, if it doesn't come, that's a memory deficit. Visuospatial, बाथरूम ये बाजू है कि वो बाजू था, अरे कल तो मैं ये गली में गया था, इधर ही तो शॉप था, ये शॉप इधर से चेंज कैसे हो गया? अरे भैया तो वो गली में गलत गली में घुस गया है. यू हैव गॉन टू अ डिफरेंट लेन, यू शुड बी गोइंग इनटू द राइट लेन, यू हैव गॉन इनटू द लेफ्ट लेन. दैट इज कॉल्ड विजुओस्पाशियल. जाने आने का डायरेक्शंस गुम हो जाना. सोशल कॉग्निशन, एपैथी, सोशल इनहिबिशन, ये सब आगे की बात है. ओके, सो मल्टीपल टाइप्स ऑफ मेमोरी डिसफंक्शंस कैन बी देयर. All these memory dysfunctions are also associated with neuropsychiatric illness. सबके साथ बिहेवियर का प्रॉब्लम आता है, साइकियाट्रिक डिसीज आते हैं. सबसे कॉमन है डिप्रेशन, एपैथी. एपैथी माना जिसके अंदर आपको इंटरेस्ट नहीं पड़े, कोई चीज में आपको रुचि नहीं हो. ब्यूटीफुल म्यूजिकल नाइट चल रही है लेकिन आपका तो दिमाग दिल ही नहीं लग रहा है. एक्साइटेड कन्वर्सेशन चल रहा है शेयर बाजार के बारे में. एक जमाना था जब भी आप शेयर बाजार का कोई भी कन्वर्सेशन होता था, तलवार लेके कूद पड़ते थे और बोलते थे ये लिया था, वो लिया था, ये बेचा था. आज जरा भी इंटरेस्ट नहीं है. बोलने दो उसको, जो बोलता है वो जो बोलता है. लेडीज है तो रेसिपीज की बात हो रही है, किटी पार्टी की बात हो रही, नहीं, किसी में इंटरेस्ट नहीं है. एपैथी, एंग्जाइटी, कुछ भी करने से, बिकॉज मैं भूल जाता हूं, मुझे एंग्जाइटी बढ़ जाती है, इरिटेबिलिटी एंड स्लीप प्रॉब्लम्स. ऑल दिस फैक्टर्स are associated with memory dysfunction. कैसे डायग्नोस किया जाए? मैंने थोड़ी देर पहले बताया, all those examples, again I am repeating them, some of them. Some of the common things that you used to do earlier are becoming difficult now. Strategies है, प्लानिंग है, एग्जीक्यूशन है, ये सब अटक जाता है आपका. पेशेंट्स ट्राई टू लिव अराउंड इट. मैं भूलने का चालू हो जाता है तो मैं डायरी रखना चालू कर दी है. आई नोट इट डाउन इन द डायरी. आई हैव अ कैलेंडर ऑफ इवेंट्स. सो मैं भूल जाता हूँ, रेसिपी लिख के रखता हूँ, कुकिंग के टाइम पे मैं पढ़ के. सो पीपल ट्राई टू फाइंड अ वे अराउंड इट. सो दिस इज द वे पीपल लुक अराउंड और फाइंड अ वे अराउंड. बट व्हेन यू आर स्टार्टिंग टू डू दैट, रिमेंबर इट एंड रिमाइंड योरसेल्फ कि यू मे बी सफरिंग अ डिजीज एंड इट इज नॉट सिंपल एजिंग. एंड अगर ये है तो मैं इसको करेक्ट कर सकता हूँ, एंड मैं आगे की स्लाइड्स में बताऊंगा हाउ वी कैन करेक्ट इट और हाउ वी कैन इम्प्रूव इट. Before we go into improving it or understanding, we need to understand the risk factors. कौन सी वजह से ये memory deficits हो सकती है अपने को? And there are many risk factors. Vascular risk factors such as hypertension, hyperlipidemia, कोरोनरी हार्टरी डिजीज, ये सब हमको मालूम है। ब्लड प्रेशर की बीमारी, कोलेस्ट्रॉल की बीमारी, बाईपास करा लिया, एंजियोप्लास्टी, एंजियोप्लास्टी घर घर में होती है आज। 55 के हुए और एंजियोप्लास्टी नहीं हुई तो आप सक्सेसफुल नहीं हो, आपने कुछ अचीव ही नहीं किया है। एंजियोप्लास्टी इज अ मार्क ऑफ अचीवमेंट नाउ। Every alternate person I meet, people have undergone angioplasty at age of 60, 65, 50, 55. स्ट्रेस बढ़ गया है और इंडिया में तो डाइटरी हैबिट्स खराब है, तो ये सब वजह से वी आर वेरी प्रोन। एंड इट हैज बीन फाउंड दैट इसमें से 4 से ज्यादा कोई भी कंडीशन जॉइंट हो तो तुम्हारी मेमोरी डेफिशिएंसी का पॉसिबिलिटी बढ़ जाता है। एंड व्हाई? बिकॉज द सर्कुलेशन इन द ब्रेन इज नॉट रीचिंग ओनली। अभी पौधे को पानी नहीं डालोगे तो पौधा जिएगा कैसे? ब्रेन डजंट गेट द सर्कुलेशन, हाउ इज इट गोइंग टू फंक्शन? And all these factors lead to decreased circulation, affected circulations in the brain. And then other chronic diseases जिसके आपको जरा भी परवाह करने की जरूरत नहीं है, वो डॉक्टर्स है, मेडिकल प्रोफेशनल्स है, दे कैन फाइंड आउट। सांस की बीमारी, डायबिटीज मेलाइटस, एटसेट्रा एटसेट्रा। The second important culprit for memory impairment is polypharmacy. आजकल सब लोगों को देखो 50 क्रॉस किया नहीं हो और 10 दवाई का डिब्बा लेके घूमता नहीं है। एवरी पर्सन इज हैविंग 5, 7, 8, 10 पिल्स। दैट हैज बिकम अ लाइफस्टाइल। कोई विटामिन की लेता है, कोई ब्लड प्रेशर की लेता है, कोई डायबिटीज की लेता है, कोई इसकी लेता है, कोई उसकी लेता है। किसी को कुछ नहीं होता है तो कहीं से सुन के लेता है कि मेरे को ये बोला था इसलिए मैंने लिया। That is the most culprit. Second, anti-anxiety medicines, sleeping pills, benzodiazepine. Sleeping pills have become common. That is causing affection. Anti-histaminic and सर्दी हुई हमने दवाई ले ली। मैं ऐसा नहीं बोलता हूँ कि सर्दी की एक बार दवाई लेने से आपको हो जाएगा, लेकिन रेगुलर उपचार, रेगुलर यूज करने से मैनी मैनी प्रॉब्लम्स कैन अकर एंड इट हैज टू बी टेकन इनटू कंसिडरेशन। ब्लड प्रेशर की मेडिसिन, डायबिटीज की मेडिसिन, ऑल हैव साइड इफेक्ट्स कॉजिंग मेमोरी इम्पेयरमेंट। लास्ट इंपॉर्टेंट, जैसे मैंने बोला, साइकेट्रिक डिजीज, डिप्रेशन, एपैथी और एनी साइकेट्रिक बिहेवियरल प्रॉब्लम कैन आल्सो बी एसोसिएटेड विथ हाई इंसिडेंस ऑफ मेमोरी डिसफंक्शन। ये तो हो गई बात है मेडिकल और दवाइयों के लिए रिलेटेड, बट देयर आर सर्टेन डिजीजेस which also have predisposition for causing memory dysfunction. थायराइड की बीमारी, विटामिन B12 डेफिशिएंसी, हाइपो शुगर की बीमारी, ये सब चीजों में आपको यू मे हैव प्रॉब्लम्स। द मोस्ट इंपॉर्टेंट एंड मोस्ट निग्लेक्टेड एरिया ऑफ मेडिसिन हैज बीन द स्लीप। आज तक हम कभी सोचे भी नहीं थे कि स्लीप हमारे लिए इतना प्राधान्य रखती है। स्लीप इज अ वेरी इंपॉर्टेंट एस्पेक्ट ऑफ आवर लाइफ। इट इज सेड दैट ऑल द क्लीनिंग ऑफ द जंक इन द ब्रेन अकर्स व्हेन वी स्लीप। जब भी हम सोते हैं तभी हमारे ब्रेन के अंदर का गार्बेज, कचरा सब निकलता है। अगर आप सोचो मैं सो नहीं सकता हूं तो मेरा कचरा निकलने का पॉसिबल नहीं है, वो कचरा ब्रेन में डिपॉजिट होगा, मेरा मेमोरी डिसफंक्शन हो जाएगा। Sleeping for 7 hours is important, and large amount of people suffer from what we call obstructive sleep apnea. तो आप जोर से खर्राटे लेते हो, सुबह में उठ के फ्रेश फील नहीं करते हो, थके हुए लगते हो, दिन के दरमियान 2 घंटा सो जाते हैं, बातें करते करते करके सो गए आदमी। ये सब आर द possibility that you may be suffering from OSA, obstructive sleep apnea, and it has to be investigated. Then there are some neurological disorders. Again, specialist neurologists will be able to pick that up. You don't have to worry about this. I just have listed it for the sake of listing it. And then memory dysfunction can be a part of many other major diseases like Parkinson disease, Lewy body disease, Alzheimer और vascular dementia. तो ये बात हो गई हमारी मेमोरी डिस्फंक्शन क्यों होता है और किधर हो सकता है। नेक्स्ट पॉइंट इज, what if I have mild memory dysfunction? What would be my future? Everybody wants to know what is going to happen tomorrow. It's not, they've accepted कि आज मेरा memory dysfunction है. So progressive atrophy of brain को shrink होना. You can see these 2 scans. इसके अंदर एक जो सफेद एरिया है, अपने को बटरफ्लाई जैसा दिख रहा है, वो ब्रेन के अंदर की पानी की थैली है, वेंट्रिकल्स, वी कॉल इट वेंट्रिकल्स। यू कैन सी इन अ नॉर्मल ब्रेन ये कोलेप्स्ड है, प्रेशर में रहते हैं। On the other side of the brain, on my right side, you can see that the ventricles are expanded. क्यों? कि ब्रेन जो है श्रिंक हो गया है. हम बोलते हैं ना कभी कभी तुम्हारा ब्रेन सुकड़ गया है, brain is atrophied, brain is shrinking. That is what is the cause of this, and that is going to lead to memory dysfunction. Then there are certain genetic factors which have predisposition of the underlying memory dysfunction to progress to Alzheimer. Then certain types of memory dysfunction, मैंने आगे बताया था, non-amnestic type of memory dysfunction can go towards developing vascular dementia, या तो अलग प्रकार का dementia develop करता है. And then there are other tests that can identify कि किसके अंदर memory dysfunction की possibility है, that it will progress to more serious dementia. Dementia माना बहुत serious प्रकार का memory dysfunction. So, Doctor, you have been telling too many negative things. I'm now worried and scared that I started forgetting things, and is this the end of my life? No, this is not the end of the life. Knowing is much better information, more informed than not knowing it. आंखें बंद करने से दुख नहीं जाता है. आंखें खुली रख के दुख का सामना करना is important. So what are the modifiable risk factors? Control blood pressure, sugar, and cholesterol. Treat sleep apnea. If you control this, your chances of getting it better. Avoid polypharmacy. इधर से दवाई ली, इसने बोला तो वो दवाई डाल दी, इसने बोला तो वो दवाई डाल दी, ये डॉक्टर ने बोला तो ये डाल दी, ये बोला तो ये डाल दी. दवाइयाँ is not peanuts. You can't keep on eating right, left, and center. You have to understand. And one medicine reacts with the other medicine. The other medicine reacts with the third medicine. And unless you understand this interaction, so you have to have a good physician who is going to guide you through all this. Now let us find out what is the treatment. So we understood what is minimal cognitive impairment. Now we are talking about prevention of it or slowing it down. But how do we treat it? I started feeling it. So what do I do next? So let me just move this slide and show you this slide. Yes. So physical exercises. Resistance training is a very important form of therapy for improving your memory function. Computer-based training, and I will show you some of the internationally proven research on this. Computer-based training, including virtual reality training, is very effective in improving memory function. Music therapy, again, very important. Management of mood disorders. I told you 40%, 50% of patients have psychiatric. 50% will do psychiatric disorders, and they have to be controlled. Non-invasive neuromodulation. We will be talking on that. Sleep hygiene, I just spoke, and social engagement, friendship. Friends are your savior. Meet more people, interact with more people, and the better you will be. But unfortunately, जो हमको आदत है, वो चीज पॉसिबल नहीं है. दवाइयां. We want pills. Pills, गोली खाओ अच्छा हो जाओ, गोली खाओ अच्छा हो जाओ. यही तो हमारी जिंदगी है. हमको कुछ नहीं करना है. Medical science medicines देगा, गोली खाओ. No FDA approved medication is there to slow down. The ball is in your court. First time you are fuss out now. As a patient, it was always the doctor who was at the receiving end. Now the patient is at the receiving end. You have to roll up your sleeves and start working hard for yourself. Doctor is not going to do that. But yes, wait. We would be showing you something very innovative and very unique, wherein you may be able to take some breather. And that is coming very fast. And that is what? Non-invasive neuromodulation, repetitive transcranial magnetic stimulation. बाहर से magnetic stimulation brain को दिया जाता है. There is a coil. In the coil, you pass a current. And in that current, because of the current, there is a magnetic field induced, which stimulates the cells of the brain. So what is the evidence? In 2025, this is the most recent paper. In this randomized clinical trial, जिसमें randomized clinical trial जो होती है, वो सबसे robust और strongest प्रकार का medical trial होता है, जिसके अंदर proof जब ये आता है, तभी बहुत ही seriously माना जाता है. So they found that repetitive transcranial magnetic stimulation enhance clinical benefit of Tai Chuan in improving sleep quality and cognitive functions among older adults with sleep disorder and minimal cognitive impairment. And it may be result of altered neural plasticity, brain की functions alter करने से. Again, another very big study from Canada, multi-centric study, many centers were involved, and a very important, a very large study showed that cognitive remediation, wherein I told you about computer-based cognitive training, virtual reality, that is cognitive remediation, and non-invasive neuromodulation in the form of direct cortical stimulation had shown to be beneficial as compared to people not receiving any of this therapy in improving their memory function. Another proof of in science is a meta-analysis. When you do a systematic review and collect all the data published at that time in the literature. In 2020, a meta-analysis of repetitive transcranial magnetic stimulation showed out of 13 studies and 300 patients that the random effect, it's a type of a statistics, was quite large in favor of rTMS over sham. Sham mana non-stimulation in improving cognitive function. In 2021, another meta-analysis showed that repetitive transcranial, deep TMS and repetitive transcranial magnetic stimulation had significant impact on neuropsychiatric symptoms and cognition as compared to sham stimulation. And even if still you want to learn or have to be convinced more, this is a list of several papers published in this field which are supporting the evidence of the use of repetitive transcranial magnetic stimulation for memory dysfunction across various randomized controlled trials from 15 to 25, high frequency stimulation over dorsolateral prefrontal cortex area of the brain or parietal region produces the most consistent benefit. Cognitive training became combined with rTMS, enhances the and prolongs cognitive improvement. Effects generally persist for 3 months and post-treatment with good tolerability. And despite variability of the protocol and small sample size, evidence supports rTMS as a promising adjunct for early cognitive decline. And how is this given? Ms. Patole, our restorative department's manager, would be showing you in a little more detail about this. But basically, we have at Jaslok invested in a very advanced setup of repetitive transcranial magnetic stimulation, which is the only one in Western India. It has got high level of effectivity and precision. Again, I will not bore you with the technicalities, but you have to take my word. And my word is not my personal word. It is a word of science showing that it is more effective than routine areas of transcranial magnetic, routine rTMS or transcranial magnetic stimulation. It is called deep transcranial magnetic stimulation. And the fact is that for every disease, we have different head coil, which is a very expensive feature to have. Itself tells you that this is a very specialized, unique form of treatment. This is the setup. Again, Sampada will talk to you a little more on this detail. And these are the results at Jaslok Hospital. These are two different memory assessment tests, before and after. You can see that patients undergoing repetitive transcranial magnetic stimulation with deep transcranial magnetic stimulation therapy at Jaslok, their scores have increased significantly. 26.33 is almost normal. 29.33 is actually normal. From a moderately impaired memory, the patient could regain memory after this non-invasive neuromodulation therapy. And let me share you the experience of a doctor. Today, we are going to talk about deep TMS treatment for mild cognitive impairment. Mild cognitive impairment is impairment of memory day-to-day functions, like forgetting things where you kept it, or forgetting things like taking pills. You have taken a pill in the morning and you are not able to remember that, or not able to remember what you ate in the morning or whom you had to call, etc., and it does cause a lot of functional indicator. We have a gentleman with here who has undergone this treatment of deep TMS for mild cognitive impairment, and let us understand his experience about this. Can you please introduce yourself?
I'm a Kiran Parekh, associated with medical professions and working in USA. In last 6 months, gradually I was started forgetting names of the patients or forgetting the correlation between the words or forgetting the what recently I was doing and what I supposed to do. So there was a lot of combination was there associated with the which is coming in a way of making decisions, talking to the people, all that things. So I met Dr. Doshi and he has advised me to go under the treatment. This treatment is kind of a 15 sittings has they have done it and putting a kind of a magnetic waves in the brain and re-identifying my thought process and everything. Now at the end of the 15 sittings, I could see so much difference in my tremors, so much difference in my thinking power also. I gained my confidence back that I am not on the verge of losing my memory.
Thank you. So we did an objective scoring about his memory before and after starting the memory, this deep TMS treatment, and we found that his memory score, which were in the range of mild to moderate impairment, have all become normal. Today we are. This is another patient. Okay. I'm going to tell your name differently. Miss Rekha, can you tell me what were you suffering from and what brought you to our center?
Yeah, initially, before coming here at Jaslok, I had a lot of problems like remembering things, a lot of confusion, and I used to forget my medicines, which I used to take daily. Counting money also was a problem. A lot of irritation, confusion, all my daily calls were very bad starting from the morning. Now, after taking 35 sessions, I'm feeling much, much better. Better in my confusion has been solved. And I remember what I copy. Otherwise, I never used to know. I used to make mistakes while copying. But now that has been really solved. And I really feel happy and confidence.
When we examined her,
Yeah.
mini mental examination scores were around 26, 25, 25, and MOCA, Montreal Cognitive Battery, also was around 26. Now, after 35 sessions of DBTMS, the MOCA has improved to 29, and mini mental scores have improved to 29. Both of them have improved to 29.
I'm feeling much better, doctor.
Yeah.
Yeah.
And your tiredness and laziness?
Tired, laziness, I've become more active, more looking forward to life, actually, to say, and really enjoying my life.
Okay. So that is the way the impact of deep TMS is on two different types of memory dysfunctions. I showed you one is name finding, another was more of a executive function, and both patients had improvement after that. And this is just for example. It's not that we can show you all the patients. We now switch gears and we come into discussing about migraine. And again, migraine, you will be surprised that it's a very common disorder. It is affecting almost 14% of the people globally. And on any given day, 17% of patients or people may be having a migraine, which is a huge burden to the society and the patient and the other things. So some of the slides have been given to me by one of our foremost headache specialists and a friend of mine, Dr. Ravi Shankar. So Ravi, I'm thankful. Thank you for that. Uh, Headache. Migraine is synonymous with headache. Headache is synonymous with migraine. And if I ask you what are the common causes of headache, you would start with vision problems, sinus, stress, dental. Then you will talk about migraine and then other things. But you will be surprised that migraine is the most common of the headache cause of headache, not the sinus, not the tension, not the acidity. And if you look at this tower, you would see that 70% of this space is occupied by migraine, the headaches, and then rest of the 30% headaches could be because of some other reasons. So do not try to procrastinate, do not try to delay, get the diagnosis of your headache resolved so that you can get appropriate treatment. So what are the danger signals, especially when you get headache? New onset headache, progressively worsening headache, severe headaches out of the blue. People like, my head is bursting. That cannot be migraine. That cannot be something simple. You have to get it investigated urgently. Headaches not responding to common treatment. All headaches with some kind of neurological deficit, some weakness in the hand, speaking difficulty, or any kind of neurological difficulty, then you should always think. And headache when fever could be a cause of brain infection or viral infection. As I told you earlier, 90% of the headache are primary headache. 10% of the headache could be because of those other things like brain hemorrhage or a brain tumor or um, infection or anything. So exactly what is migraine? Is it a disease of nerve? Is it a disease of blood vessel? It is a neck muscles. It is all. And migraine comes in a particular pattern. So then the first thing is multifocal interictal phase, where you do not have symptoms, but you have triggers. These triggers can start causing migraine, and these triggers, we will talk about it later. There are many triggers that leads to craving, yawning, fluid retention, and heightened perception, sensory perception. You start feeling things around you much better. Then it leads to aura. You start having changes. Some people say, मुझे black bubbles दिखते हैं आगे, आँख के आगे. Some people might find speech difficulty or numbness. Some of the patients can have it. Not all patients will have it. And then this is followed by headache with sensory disturbances. Nausea and vomiting is a common association of migraine symptom. So when you get nausea and vomiting along with headache, there is a good possibility that you are having migraine, and then it slowly fades away. So this is the cycle of migraine. And migraine is a disorder because of the nerves and the blood vessel also. There is a neurotransmitter CGRP and substance P release, which can cause and trigger migraine attacks. Similarly, there is a hypersensitivity of the nerves, right from the trigeminal nerve, the fifth nerve, which is in the trigeminal ganglion, which is in the neck, right to the head and to the top of the head, cortex, on entire area that are involved in the circuits of migraine. And I will again not go into the technicalities and details of this because that is not a part of this today's talk. Migraine could be one of the most common causes is genetical inheritance. So if you ask more detail, parents को migraine था, भाई बहन को migraine है, किसी को और है. Influenced by trigger factors, and as I told you, it is a disease of brain, nerves, blood vessels, neurochemicals, pain centers. And the treatment options, medical treatments are available, and they can act at different places to break the cycle. So common features of migraine, they are one-sided, associated, could be mild, moderate, or severe. As I said, they are throbbing in nature. Tuck, 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 tuck. Nausea and vomiting are common accompaniments, but not necessity or a must. And intolerance to light and noise. People are not tolerant when the headache is there. They don't like light or noise. So what are the common triggers? Excessive sleep, flicker phenomena. Sitting in front of computer can suddenly on strobing light, flashing light, disco lights in a discotheque, that all can some patient. Every patient has different trigger. It's not that a patient A would have the same trigger as patient B. High humidity, cold foods, chocolates, pungent thing, allergy, everything. What are the non-pharmacological options of treating migraine? Obviously, we know there are a lot of medications, and medications are very effective. But some patients are allergic to medications. Some patients do not want to take lifelong medications. Some patients are having attacks despite taking medications. So other things can be done: relaxation, hypnotherapy, thermal biofeedback, cognitive behavioral management, acupuncture, transcutaneous electrical stimulation, cervical manipulation, many things are there. This is a slide from Dr. Ravi Shankar again. He has said that there have been more advances in headache field in the last 20 years than in the last 2000 years. So we come to the definitive treatment or solution for this difficult to treat headache. People are fed up. People have been suffering for 10 years. I have friends. I have many friends who are complaining of this headache for years and years and years. And they're living with it. What do they do? 4 days or 5 days of a month, when they are disabled because of that, they stop their work or they decrease their work. Again, they go back to work and they feel that that is a part of the life. We have strong evidence to suggest that non-invasive neuromodulation in the form of repetitive transcranial magnetic stimulation can be an effective treatment for controlling migraine attacks. So this paper was published in 2016, and they showed that high frequency deep TMS of dorsolateral prefrontal cortex was successful in reducing the frequency of attack. 1 month follow-up revealed lesser severity of symptom as compared to pre-intervention. In 2022, another important paper was published. They explored routine transcranial magnetic stimulation, or rTMS, and they found that stimulating either motor cortex or dorsolateral prefrontal cortex had the similar effect in reducing the headache frequency and severity. There have been analysis. I told you, meta-analysis is the best way to analyze the data and to represent the data, especially when you have small numbers of case studies or small series. 8 randomized controlled trials, including covering 384 patients, almost 400 patients, showed that repetitive transcranial magnetic stimulation groups had fewer attacks, had less intense attacks, and had to use less number of abortive medication. Once again, for people still want more evidence, this is a list of many other research papers published in the field on rTMS and its efficacy on the migraine. And what is the summary of all these papers? rTMS has shown promise in both acute and preventive migraine therapy. High frequency stimulation of the motor or prefrontal cortex, I told you earlier, both improves migraine frequency and severity. Several randomized controlled trials and meta-analysis report efficacy comparable to other forms of treatment. So if you are fed up of taking medicine and you are looking for some alternative solution, this may be one thing to be considered. And FDA approved some form of non-invasive neuromodulation, not the deep TMS that we are talking about. So that is likely to get approved sooner. Let us end by a testimonial. This is a patient of migraine who was treated by deep TMS.
इनको माइग्रेन का बहुत बड़ा प्रॉब्लम था, तो हम लोग ने डॉक्टर परेश जोशी के पास आए थे, तो उन्होंने डीप टीएमएस का अपने को बोला था, तो हमने डीप टीएमएस इनका करवाया, तो काफी फर्क गिरा। पहले क्या माइग्रेन होता था तो आधा दुखता था और सर पटकते थे और उल्टियां बहुत करते थे। अभी उल्टियां उसकी पूरी बंद हो गई और रेगुलर दवा लेते थे, फिर भी उसको माइग्रेन का अटैक आता, अभी एकदम बंद हो गया है। कभी कभी होता है, नॉर्मल होता है, लेकिन उल्टी तो बिल्कुल ही बंद हो गई है और बहुत अच्छा है। थैंक यू और टीम का सबका धन्यवाद।
With that, I would like to thank, and I would like people to write their comments or questions in the chat, and I will try to answer few of them if I can in this webinar, or they can later on also send their message or comments and we will try to respond. I will hand over now to Ms. Sampada Patole to show us what exactly what we are talking about. What is this deep TMS and how do we do it and what we do? Yeah. Sampada, you can start. Sampada, we can't hear you. Hello. No, we were able to see the screen correctly. Yeah. Ah,
1 second, sir.
yeah. It's better
Yeah.
now.
या मैं आपको इंट्रोडक्शन बताऊंगी डीआरटीएमएस के बारे में। ये नॉन इन्वेसिव प्रोसीजर होती है, इसमें कोई भी मेडिकेशंस नहीं देते हैं, कोई भी एनास्थेसिया सर्जरी नहीं होता है। ये मैग्नेटिक फील्ड होता है जो ब्रेन स्टिमुलेशंस देता है। आप ये मशीन देखोगे तो यहाँ पे 3 हेलमेट है। एक है येलो कलर का हेलमेट जो हम यूज करते हैं फाइब्रोमियल्जिया पेन के लिए, क्रॉनिक पेन के लिए, एमसीआई के लिए एंड ओसीडी पेशेंट के लिए। जो ब्लू कलर का हेलमेट दिख रहा है वो है H1 हेलमेट और डिप्रेशन के पेशेंट के लिए यूज करते हैं एंड फाइब्रोमाइल्जिया। ग्रीन कलर का हेलमेट जो H4 हेलमेट है वो यूज करते हैं एडिक्शन के लिए एंड स्ट्रोक अफेजिया के लिए। हम लोग मोस्टली इसमें कवर करते हैं डिप्रेशन, एंजाइटी, ओसीडी, एमसीआई, ऑटिज्म, क्रॉनिक पेन एंड एडिक्शन, फाइब्रोमाइल्जिया। इधर ये जो ट्रीटमेंट होता है ये 2 टाइप्स का आता है। वन है थीटा बस्ट एंड सेकेंड वन इज कन्वेंशनल टीएमएस। थीटा बस्ट होता है ये शॉर्ट बस्ट होता है, हाई फ्रीक्वेंसी दैट इज 50 हर्ट्ज एंड इट कैन बी कंप्लीटेड इन 3 to 5 मिनट्स। ये 1 डे में हम 5 सेशंस देते हैं, कीपिंग इंटरवल ऑफ 50 मिनट्स टू 1 आवर। ये पेशेंट को बहुत कन्वीनियंट होता है क्योंकि पेशेंट के पास टाइम नहीं होता है, तो 1 वीक में हम लोग 25 to 30 सेशंस कंप्लीट कर देते हैं। कन्वेंशनल में रहता है हाई फ्रीक्वेंसी स्टिमुलेशन एट स्टैंडर्ड रेट ऑफ 18 to 20 हर्ट्ज। ये सेशन होता है 15 to 20 मिनट्स के लिए एंड ये सेशन पर डे 1 सेशन, ऐसे 5 सेशन वीक में देते हैं, ऐसे 6 वीक्स के लिए आता है। तो ये थोड़ा लेंथी होता है, थीटा बस्ट वाला शॉर्टर होता है। पेशेंट प्रिपरेशन में पेशेंट को पूरा हिस्ट्री पूछते हैं। किसी किसी को कन्वर्जन का हिस्ट्री है तो हम लोग मोस्टली डीप आरटीएमएस नहीं करते हैं, उनको न्यूरोलॉजिस्ट के पास जाके फिर लेटर लेना पड़ता है कि मतलब वो फिट है या नहीं है। फिर कोई कोमोबिडिटीज है, करंट मेडिकेशन है, वो भी चेक करते हैं। ये ओपीडी बेसिस प्रोसीजर होता है, इसमें कोई फास्टिंग या कुछ भी जरूरत नहीं होती है। पेशेंट कॉन्शियसली चेयर पे बैठा है, आप चेयर पे देखोगे तो पेशेंट एकदम अलर्ट रहता है, कोई भी मेडिकेशन भी नहीं देते हम लोग। ये
just 1 minute. People can type in question and answer. Someone are saying the chat, they are not able to type. So if you want to type, you can put question and answer in Q&A. Yeah, carry on.
ये प्रोसीजर हम लोग सपोज पेशेंट को कफ कोल्ड फीवर है तो उस पर नहीं करते क्योंकि उसमें कन्वर्जन का चांसेस होता है। इसमें की कॉन्ट्रा इंडिकेशन है, लाइक कोई भी मिडल पार्ट बॉडी में है तो उसके लिए भी फिटनेस लगता है एंड हिस्ट्री ऑफ सीजर्स। डॉक्यूमेंटेशन में हम लोग रिटर्न कंसेंट लेते हैं जैसे कि हर एक प्रोसीजर के लिए लगता है। पेशेंट सेफ्टी स्क्रीनिंग होता है, उसमें एक क्वेश्चनर होता है लाइक एडवर्स रिएक्शन ऑफ द टीएमएस, उन्होंने पहले टीएमएस लिया है क्या, उनको हिस्ट्री ऑफ सीजर्स है क्या, स्ट्रोक हुआ था क्या, कभी हेड इंजुरी हुआ है या कोई इम्प्लांट है, पेसमेकर है, वैसी हिस्ट्री पूछते हैं पेशेंट को। एंड पेशेंट का ये डॉक्यूमेंटेशन है जो ट्रीटमेंट शीट में लिखा हुआ है। पोस्ट ट्रीटमेंट में इसमें कोई मतलब ऐसा रिकवरी पीरियड नहीं होता है, बट पेशेंट को हम लोग बोलते हैं 5 to 10 मिनट्स बाहर रिकवरी रूम में बैठ जाइए, क्योंकि कभी कभी ऑब्जर्व करना पड़ता है पेशेंट को, कभी कभी स्कैल्प डिस्कम्फर्ट या हेडेक होता है, तो उसके लिए हम लोग पेशेंट को बोलते हैं यू कैन टेक आइदर डोलो और क्रोसिन। कोई कोई पेशेंट लेता भी नहीं है और पेशेंट को हम लोग एनकरेज करते हैं इनफ वाटर पीने के लिए, ड्रिंक वाटर, इनफ वाटर। दैट्स इट, थैंक यू। Sir, it's done.
Yeah. So yeah, do you want to share the short video of the department?
Sir, I'm not able to play that video.
Okay, so let me see if I can. I will share. Let me see. First of all, don't worry. Yeah. Uh, Give me a minute. You can send it from the RNR phone.
Yes, sir.
So I will download. Just a second. Uh, okay. So let me share the screen again. Share.
Currently, we are on the seventh floor of the Jaslok Hospital and Research Center. This is our restorative and regenerative department. Welcome to our restorative and regenerative department. This is our patient's waiting area. Now we will move towards the consultation room. This is a consultation room. Our pain specialist, neurosurgeon, neuromodulation, and psychiatrist consult the consultation OPD over here. Then we will go towards the deep rTMS room. This is our deep rTMS room. We have advanced FDA approved deep rTMS machine with 3 different helmets. This is S7 helmet. We use it for the OCD, autism, MCI, and for the chronic pain. This is H1 head helmet. We use it for the depression, anxiety, and for the fibromyalgia pain. And this is H4 helmet. We use it for the addiction and stroke aphasia. This is our procedure and patient's examination room. Here we do all procedures like USC cardiac nerve block, PRP, hyaluronic acid injection, point injection. For the PRP, we use this centrifuge machine, and for all the USC guided procedure, we have advanced USC machine.
Okay, I think I stopped sharing, and there are some questions, and let me read it and answer it. So can an 80-year-old man undergo this therapy? Yes, you can. And cost of the therapy is around 4,000 per session. Usually, depending on the type of evaluation and sessions required, it ranges from 50 to 15 sessions to 30 sessions, and that would be the cost. It does not, someone is asking, does it solve the problem of migraine permanently? Unfortunately, no. Even medicines you have to keep taking lifelong. So here, if you get again recurrence of migraine symptoms, depending on patient to patient and individual to individual, you might have to repeat it. We have to visit on OPD basis. Yes, you have. This is an OPD based procedure, so you do not have to come get admitted. Someone is asking, sir, I agree and got it that medication, especially psychiatric medications, and may affect memory, but sir, only therapy doesn't help with psychiatric disorders, right? So yes, that is right, that only therapy will not help. We have to take medication, but it is just that it's like diabetes. Diabetic medications also affect memory, but what do? You can't suffer from diabetes. So we have to take it. But if we are taking it, if we are aware, then we are more cautious and then we take it correctly. Is there any medication or something that forgetting things memory? I told you there is no medication. You have to do your own help. And I showed you many things. And the recording of this webinar will be available. So you can follow up the recordings later. If you have registered, we will send you a link of the recording. Hi, sir. Is there any action to be taken if I am having severe headaches at work please suggest it. The headaches have to be analyzed. Unless we analyze the headache, we don't know what is it coming from, and we have to do the evaluation. Someone is again asking whether there are any adverse effect of deep TMS. There are hardly or almost no adverse effect of deep TMS. It's a non-invasive neuromodulation. That is the beauty of it. It has no side effects of medicine. It has no risks of surgery. So I don't think it can get better than that. Can you also help schizophrenia? Yes, schizophrenia can be treated. This is the most effective treatment for OCD, and it can give you remission of up to 2 years. Cluster headache can be treated. We have not yet treated, but we can check the scientific literature if there is any cause of that, and we can treat it. Yeah, I think I've answered all the questions now. And if there are no more questions, I think we can plan to leave. And I again thank everybody for joining this webinar and being so interactive. And I hope this was of information to everyone. Thank you. Good night.